Very good. One more. Good. There it is. God, face up for me. Again. Okay guys, Dr. Randy, Kalkstein Family Chiropractic. Got Tyler here in the office. He's in for low back and neck pain. He's been coming in for quite a while, but he works for UPS, so a lot of lifting, a lot of repetitive lifting. We see that a ton in the office. That repetitive wear and tear, although it's low grade at the time, will take its toll in your spine. So he comes in more or less he's been coming in for maintenance. Is it worse? Is it a lot worse today?
It's actually better today than it normally is.
Okay, so it's more of a maintenance adjustment. Again, for low back and neck are his two biggest issues. So let's get to work. Start off with some muscle work here, kind of both sides right through here.
Yeah.
Does it radiate down your leg at all?
No, not really, because I think that most of the lower pain comes from like up in between the shoulder blades.
Okay, you feel like it radiates down a little bit?
Yeah.
You got it. Just doing some soft tissue on his paraspinals. Take a nice deep breath in for me. Exhale, my man. Good. 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 Very good. One more. Good. Do some traction. Alright, so just an flexion distraction technique. Just good extra flexion distraction of his lumbar spinal joints. Great for low back and hip pain, this technique. Does your pain seem to get better or worse, like at work, like with activity? Like, do you feel good in the mornings and then get worse as the day goes on, or is it the opposite?
Yeah,
You feel
honestly, it's usually after work when it starts to bother me and I notice it.
Yeah.
It's not really during work. I mean, it can be, but most often it's after I get home and, stop moving a lot.
Got it. So you go home to relax, settle down, and you start to,
Yeah.
back pain starts to act up. Go on your side for a second. Take a deep breath. Exhale. There it is. Other side. Deep breath again. Exhale, Tyler. Good. God, face up for me. Just relax his shoulders nice and light here, my man. Good. And one more, nice and easy. Good. Let's pick your knees up for me. Relax them. How's your neck pain more at the base of your skull or down more towards your spine?
It's like, usually yeah.
Those sides kind of
Yeah.
top there? Yeah. You okay here? Pull over here. Again. You don't crack your own neck, do you?
Sometimes I do. I try not to. Just sometimes like it hurts so bad that I feel like I gotta crack it.
Okay. I've talked to you about that before, right?
Yeah.
Okay, just relax your shoulders. Try one more nice and low here. There it is. That's better. And last one. Let that head relax for me. There you go. Much, much better. So he's kind of hard to adjust. And I said, like, not about cracking. We talked about cracking your own neck. When people try to crack their own neck, or back for that matter, and you do that, you get that popping sound. You're not popping or adjusting the joints of your spine that need adjusted, that are restricted. You're only moving the ones that are already movable. So you'll get a popping sound and it will feel better temporarily, but the joints that are restricted, that are maybe slightly misaligned, the ones that are causing the problem that we're gonna try to fix in the office, those become even more restricted. So you feel good for a little bit, but you actually make the mechanics of your spine worse because you make the joints that are locked more locked up. So just a little tip, hang on there. It's okay to stretch, but try not to be popping your neck around. Good, this one here. Okay, one more thing, just go face down for me. Because he's so tight, we're gonna do a little extra soft tissue work in his shoulders and he's gonna be done. And I think it's just the nature of his job. You're loading trucks, right?
Yeah.
And you're super busy.
A lot of lifting.
It's a lot of lifting, yeah. Non-stop, busy, long hours on his feet, you know, a lot of repetitive bending, like we said. So he's just, you know, tight everywhere. And, but the alternative is, if he doesn't come in, he's gonna have an extraordinary amount of scar tissue and wear and tear built up in the spine. And just have so much more chronic problems and limitations as the years go on. So he's doing the absolute right thing by trying to keep up with it. And I can just tell how hard his job is because you can feel the sort of tightness in the muscles around his spine. Okay, come on up, shoulders, and you're done. Just a little extra soft tissue that way. Get it down, relax. We actually got your neck better than usually.
Yeah, I could tell.
That second time with the camera, we really got it. You're set.